is what we want to ultimately prevent. The most common side effect with ACE inhibitors, as you probably know, is a dry cough. Now, some people might complain about it as a tickle in the throat. This is something that for some people it's tolerable, but from most people, from what I've talked to, is that it's actually quite debilitating and is very uncomfortable and very annoying. So there's an easy fix to this. You can always switch it to a cousin of it called an ARB, or angiotensin receptor blocker, instead, if you happen to have this issue. Now, on a very rare occasion, some patients may